Hello again, everyone. This is Michael Jones, and I'm continuing to talk about this Advanced Medical Exercise Specialist Virtual Workshop. Now, if you want to get information and register, go over to AMESWorkshop.com. And please remember, the course is held October 20th through 23rd. Our on-site workshop is sold out, so we're offering this virtual option for 10 participants. And one of the things we're going to ask you throughout this workshop is, are you doing personal training or are you doing medical exercise training? I know a lot of you out there are trying to make the transition. You really want to work with the medically based client for the majority of your training sessions, but you're stuck and you're not quite sure how to do it. And when you do get a medical exercise training client, you revert back to personal training habits and skills. So one of the things we're going to ask you is, are you personal training? And that basically is you're developing an exercise program for a client with a medical condition. Or are you performing medical exercise training and managing a medical condition with exercise programming? There's a difference between the two. And this course is going to really get you to start looking at that clearly and helping you make the transition to medical exercise training. Now, we're not saying dump all your fitness clients. No, not at all. But the longer you work with your fitness clients, the older they get and the more medical conditions they have. So really, having the fitness clients around, eventually they're going to evolve into medical exercise training clients, but being open to the idea of gradually transitioning or evolving away from personal training to medical exercise training is important. We're going to cover that in this workshop. So one of the key things is, yes, exercise is medicine, but it's only if the exercise is dosed properly and effectively. And with that, these are some of the medical exercise dosing factors, and we're going to go over these in the Advanced Medical Exercise Specialist Workshop. Frequency, duration, sets, reps, intensity, rest, healing constraints, assessment, cognitive status, inflammation, meds, neural capacity. We're going to talk about a lot of these things in the 4-day on-site workshop, and this is the most intense workshop you'll get any place on medical exercise or medical fitness or post-rehab. So, the personal trainer, you focus on fitness programming. You look at screening and consultation and utilizing the PAR-Q. Your assessment and the exercise are done in the same session. You work around a medical condition. You have no specific program and no medical exercise training protocol for the client. You have no short-term or long-term goals. You have no documentation or communication. You have a minimal understanding of clinical anatomy. Now, you understand muscles and bones and organ systems. That's basic gross anatomy. But clinical anatomy is what's gone wrong with the disease process or the injury. And you look at it, if the client feels better, then the exercise program is working. But folks, here's one thing that you got to think about. Exercise makes everybody better at some point. Whereas the medical exercise specialists, they conduct a medical history interview. They perform an MET assessment and they check the client's vital signs. They identify the client's diagnosis, the red flags and functional deficits, and they don't make a diagnosis. They're getting that from the client or from the doctor, therapist, or chiropractor, because we're not training anyone to be a medical professional nor take the place of the physician, the therapist, or the chiropractor. They establish short and long-term goals. They focus on functional outcome measures. They refer to medical exercise training protocols to make sure they're covering all the bases and nothing is falling through the cracks. They incorporate a fitness and wellness component so the client loses weight and they feel better and they're healthier. They also document the assessment, the session, and the progress the client is making, and they communicate with medical professionals. So, throughout this Advanced Medical Exercise Specialist virtual workshop, we're going to challenge you. Are you a personal trainer or are you a medical exercise specialist? So, if you want to make the transition, go over to AMESWorkshop.com and get registered so you can make the transition. It's not easy. I can tell you, it's not easy. We've done this now for 28 years. We've had some folks that have been certified with us for 25 years, and they're taking the course, and they're still finding it's still hard to make that transition. So please join us. Make the transition, because I guarantee you, folks, we're going to need more and more dedicated, competent, confident, experienced medical exercise specialists over the course of the next 2 decades. So, AMESVirtualWorkshop.com, we got 10 slots. Get registered. We'll see you then. Take care.